To start with, if you feel uncomfortable with your diagnostic skills, then every once in a while take a caries risk test to confirm that the tracking exam is providing you with the information that you need to assess a risk for that particular patient. A caries risk test provides a basis for evidence-based care. This is something that the patient can see, that you can see. You'll be able to look at the bacterial counts and you know that those strep mutans and lactobacillus are there and present. Can provide a basis for customized treatment, helps you with your evaluation and findings, helps the treatment that you're going to recommend in the office, and also the treatment that you're going to recommend for the patient to take home with them. Caries risk test evaluation: a low caries risk, little or no plaque, no initial cavity lesions, strep mutans count of less than 100,000 colony forming units, lactobacillus is the same, and a salivary flow rate greater than 1 millimeter per minute. High caries risk rates: plaque is present, lesions started, gingival bleeding, strep mutans and lactobacillus colony counts of over 100,000 colony forming units per millimeter of saliva, and a lower salivary rate, less than 0.7 millimeters per minute. This is what a caries risk test looks like. We use them now based on the clinical judgment as you as a provider. It's a great parent-patient motivator. It confirms your clinical diagnosis graphically and something that the parents can see or the patient can see that they actually have these bacterial problems. You can purchase the product from Ivoclar Vivadent. You need an incubator and these individual tests. Also allows you to measure salivary flow rate. This is an active slide that we had a patient do. This shows greater than 100,000 colony forming units per millimeter of saliva. All those little white dots there are the bacteria. This is a strep mutans test. This is a lactobacillus test showing, again, greater than 100,000 colony forming units per millimeter of saliva. This a lot of times is indicative of a patient that's consuming large amounts of carbohydrate, fermentable carbohydrates. Salivary flow rate: this is a very important test to look for. Doesn't have to be done all the time on all patients. Usually your observation skills will provide you the ability to see whether the patient has sufficient saliva. But the salivary flow test is done the following way: have the patient chew a paraffin pellet for 3 to 5 minutes, have them spit into the cup continually during that time. Tell them not to swallow their saliva, to spit in the cup. Measures the saliva at the end of time period and divide by the time to determine the millimeters per minute of stimulated flow. Salivary flow test: these are the rates that we're looking for that we think are significant. Levels greater than 1 millimeter per minute is standard and lowers the risk for oral disease. Levels less than 0.7 millimeters per minute is below normal and is at moderate risk level for oral disease. Levels less than 1 millimeter per minute is referred to as xerostomia and is a very high risk for oral disease. Factors affecting salivary flow: pharmaceuticals, over-the-counters and prescription. Radiation therapy also affects salivary flow. It's important here to maybe indicate that, particularly in your geriatrics, although there's radiation done in and around the throats of young children, that once the glands have undergone radiation therapy, the saliva that's emitted by those glands is more acidic. So the use of xylitol gum without a buffering agent can put the patient at more risk because the saliva being emitted by that gland will be an acid saliva. So in that cases, you want to choose your xylitol product that would have a buffering agent such as calcium lactate gluconate, or calcium glycerol phosphate. Systemic conditions that can also affect salivary flow: Sjogren's syndrome, and another is the amount of water that the subject is taking. In today's world, we're drinking more and more pop, which is not the same as drinking water. So caution your patients if they have dry mouth that they need to substitute their fluid intakes.